Hello and welcome. My name is Jody Lounsbury. This presentation will introduce you to the patient care process for delivering comprehensive medication management. Upon completion of this presentation, you should be able to discuss the importance of the patient care process, describe the functions of the patient care process, explain the intentional order of medication assessment, and describe the 10 categories of medication therapy problems. As you recall, there are 3 components of CMM: the philosophy of practice, the patient care process, and practice management. We will focus on the patient care process in this presentation. Why is a standard care process important? Establishing a common language for the delivery of CMM is important to ensure a consistent approach to optimizing medication use to improve patient care. A standardized process differentiates the pharmacist's role on the care team, which is to optimize medication use. This allows members of the healthcare team to know what to expect from the pharmacist, as well as determine how best to integrate the pharmacist within the interprofessional team. Similarly, for patients must understand the services provided. Having a standard process is necessary to demonstrate the distinct value pharmacists bring to the team, to patients, and to groups external to the profession. Creating a standardized process of care is not unique to pharmacy. It is well recognized in healthcare that setting standards encourages providers to approach patient care in a consistent manner. The process allows pharmacists to deliver the same care to all patients, creating consistency patient to patient. Pharmacists delivering CMM use a specific patient care process. The Joint Commission for Pharmacy Practitioners, or JCPP, representing 11 national pharmacy organizations, endorsed a framework for providing clinical patient care services called the Pharmacist's Patient Care Process. This patient care process involves a patient-centered approach in collaboration with other providers on the healthcare team to optimize patient health and medication outcomes. An essential first step is the establishment of a patient-pharmacist relationship that supports engagement and effective communication with patients, families, and caregivers throughout the process. In addition, at the core of the process, pharmacists continually collaborate, document, and communicate with physicians, other pharmacists, and other healthcare professionals in the provision of safe, effective, and coordinated care. In the learning module, we have a link to JCPP's framework, which provides an overview. However, the patient care process for delivering CMM resource provides a common language for delivering CMM. This common language document provides operational definitions to the essential functions of the patient care process. Let's walk through each function, starting with collect. The pharmacist assures the collection of necessary subjective and objective information about the patient and is responsible for analyzing information in order to understand the relevant medical and medication history and clinical status of the patient. Information may be gathered and verified from multiple sources, including existing patient records, the patient, and other healthcare professionals. This process includes collecting a current medication list and medication use history for prescription and non-prescription medications, herbal products, and other dietary supplements. Relevant health data that may include the medical history, health and wellness information, biometric test results, and physical assessment findings. And patient lifestyle habits, preferences and beliefs, health and functional goals, and socioeconomic factors that affect access to medications and other aspects of care. Assess. The pharmacist assesses the information collected and formulates a problem list consisting of the patient's active medical problems and medication therapy problems in order to prioritize recommendations to optimize medication use and achieve clinical goals. This process includes assessing each medication for indication, effectiveness, safety, and patient adherence, health and functional status, risk factors, health data, cultural factors, health literacy, and access to medications or other aspects of care, and immunization status and the need for preventive care and other health services where appropriate. The order of the medication assessment, so the indication, effectiveness, safety, and adherence, or IESA, is intentional and is outlined sequentially to guide the pharmacist and the healthcare team through essential questions that must be considered in determining the appropriateness of each medication. In other words, one must determine whether an indication is correct for a medication before effectiveness, safety, and adherence are considered. Ensuring adherence becomes a final step in the assessment. And it's important to assess adherence once you know that the medication is indicated, is working, and prescribed at a dose likely to achieve clinical goals and is not causing an adverse effect. Again, this order of assessment is intentional. Indication, effectiveness, safety, adherence, or IESA, are medication-related needs. For each, there are medication therapy problem, or MTP, categories. And not pictured on the slide here, but there are also medication therapy problem rationales for each MTP category. For example, for the MTP, unnecessary medication therapy, the rationale could be duplicate therapy, no medical indication at this time, non-medication therapy more appropriate, addiction or recreational medication use, or treating avoidable adverse medication reaction. So this medication therapy problem categories framework is a consensus document developed by the Pharmacy Quality Alliance. It's based on input from providers and practices and the MTP categories established in the literature. It is intended to provide a framework to standardize how MTPs that are identified during CMM encounters, how those are categorized. This standard framework promotes consistent categorization and coding of MTPs and then the related actions or recommendations to resolve the MTPs. The full framework, including the MTP rationales, are in this link here on the slide and is also available in the learning module. Let's walk through a couple of examples. So example 1. Karen is a 23-year-old woman with asthma who is experiencing increased wheezing despite adherence to her low-dose inhaled corticosteroid. So first we think about indication. She has asthma, so an inhaled corticosteroid could be appropriate. So then next, effectiveness. She's still having symptoms despite adherence to her medication. This patient's medication-related need is effectiveness. The MTP categories for effectiveness are ineffective medication, dosage too low, and needs additional monitoring. So the medication therapy problem category that best describes this unmet medication-related need would be dosage too low. Here is another example. Paul is a 42-year-old man with epilepsy who is admitted to the hospital due to increasing lethargy. He is receiving phenytoin sodium 100 milligrams every 6 hours for his seizures. When his phenytoin serum level is checked, the test result comes back as 25 micrograms per milliliter. The goal range is 10 to 20. So first we think about indication. He has epilepsy, so phenytoin could be appropriate. Next, effectiveness. As far as we know, he isn't having seizures, so the phenytoin appears effective. And now safety. Paul is experiencing increasing lethargy, which is likely due to his supratherapeutic phenytoin level. So this patient's medication-related need is safety. And the MTP categories for safety are adverse medication event, dosage too high, and needs additional monitoring. The medication therapy problem category that best describes this unmet medication-related need would be dosage too high. He is experiencing an adverse event, the lethargy, but this isn't specific enough. He is experiencing this adverse effect because the dose of the medication is too high, resulting in the supratherapeutic level and then the subsequent lethargy. Hopefully these examples help you walk through the intentional order of assessment in classifying medication therapy problems. Following assess is plan, the pharmacist develops an individualized evidence-based care plan in collaboration with the healthcare team and the patient or caregiver. This process includes establishing a care plan that addresses medication-related problems and optimizes medication therapy, sets goals of therapy for achieving clinical outcomes in the context of the patient's overall healthcare goals and access to care, engages the patient through education, empowerment, and self-management, and supports care continuity, including follow-up and transitions of care as appropriate. Next is implement. The pharmacist implements the care plan in collaboration with the healthcare team and the patient or caregiver. During the process of implementing the care plan, the pharmacist addresses medication and health-related problems and engages in preventative care strategies, including vaccine administration. Initiates, modifies, discontinues, or administers medication therapy as authorized. Provides education and self-management training to the patient or caregiver. Contributes to coordination of care, including the referral or transition of the patient to another healthcare professional. And schedules follow-up care as needed to achieve goals of therapy. And follow-up, monitor, and evaluate. The pharmacist provides ongoing follow-up and monitoring to optimize the care plan and identify and resolve medication therapy problems with the goal of optimizing medication use and improving care. This process includes the continuous monitoring and evaluation of medication indication, effectiveness and safety, and patient adherence through available health data, biometric test results, and patient feedback, clinical endpoints that contribute to the patient's overall health, outcomes of care, including progress toward or the achievement of goals of therapy. Pharmacists delivering CMM use a specific patient care process. This patient care process directly aligns with the JCPP's pharmacist patient care process. As I mentioned, the JCPP's framework provides an overview, and the patient care process for delivering CMM resource provides a common language for delivering CMM. This common language document describes the same 5 essential functions, but goes into explicit detail of what should occur with each function of the patient care process. The patient care process for delivering CMM common language document addresses the need for operationalizing the essential functions of the pharmacist patient care process. The CMM patient care process adds operational definitions to the essential functions. For example, for plan, the essential function is develop the care plan. This operational definition includes explicit detail of what should occur within this essential function. This common language document, the patient care process for delivering CMM, is available to you within the learning module. Again, this document defines each of the essential functions and clearly articulates how each function should be operationalized. This would be an important document to review to ensure consistent implementation of CMM. Here are resources on the CMM patient care process.